Your Health Matters.
In Your Health Matters, used to improve the look of varicose veins, ambulatory phlebectomy is a relatively common procedure that most of us are familiar with. But what about getting rid of hand veins that protrude? Well, the procedure is actually an offshoot of ambulatory phlebectomy, and the results have to be seen to believe. The procedure is called rejuvenation, used to remove bulging veins, a look that can happen over time or in thin people. In either case, the issue is not enough fatty tissue.
With time, as we all go through, the skin gets thinner and we lose the fat pad, so suddenly the veins bulge more.
Vascular surgeon Gabriel Gorin has done hundreds of leg varicose vein procedures over the years, and since 1995, he says he's performed some 500 rejuvenation procedures, where he, using crochet-like hooks, actually removes unwanted superficial veins in the hands.
And I'll mark the veins as they are. Then sterile field. Then I do the local anesthesia, and then with tiny little skin openings, which are 1/16 to 1/8 of an inch, using the hooks, I'll put the vein out. You can see it here.
The doctor says he doesn't count the number of veins he removes and takes them all for the best result.
The number of veins don't count. The deep veins are strong enough to take over.
You might be wondering, don't we need these veins? Well, actually, there are two systems of veins. Superficial, like the ones in the hands, and superficial veins are not paired with an artery, and they carry less blood. And then there are the deep veins.
And the most important one, the deep ones that you don't see. It's in the muscle, between the muscle, near the bone. These are the more important channels.
The deep veins are almost always near an artery, and collectively they carry the majority of the blood, about 85 to 90%, back to the heart. As for this procedure, it's also permanent, an anti-aging choice that turns back the clock.
The seniority is inevitable. Showing it is optional.
An avid fitness buff, Elise Aratune, had the procedure done nearly 4 years ago. And the photos, take a look, are telling, showing the before, the next day, and after 4 weeks.
It was a 3-hour procedure. I went in, local anesthetic. You know, I just zoned out for 3 hours. I really didn't feel anything.
And the doctor says there are no major risks except for some swelling, bruising, and bleeding at the tiny entry points. And in very rare cases, there could be a loss of sensation.
But usually it regenerates, and in a few weeks, few months, it's all going away.
Most patients are age 50 and over, or those who work out heavily with weights, as you saw in that piece, or if you're just really thin. Again, this is elective surgery, not covered by insurance. It runs about $3,000. I'm Janet Zapala for Your Health Matters.